I would like to welcome you so much to our last panel in our health journalism series, where we looked at everything health journalism in Africa. Today's panel and our esteemed guests are going to discuss what has been happening in health journalism in the past, in the present, now during COVID-19, as well as what we could expect in the future.
We had felt for long that health journalism on the African continent and worldwide had been underestimated, misrepresented, very often looked down upon. But the pandemic showed very clearly who knows what he and she was talking about and who doesn't. Health journalists, that's you people, are the experts. We will today discuss issues of quality, because tackling the scientific and medical issues is one thing. Presenting them in a beautiful way, nice to read or hear, is another.
Decades of military rule has actually affected media practice in the country, and what we saw was that there's a lot of focus on politics and other things, and so it was mostly low skill. I mean, people get drafted from the political desk or any other desk just to cover health news. The reason why we are having a upsurge in health misinformation right now is because the local media here, even health journalists, are not first and foremost providing the right information to people. Some of them have actually even fallen victim of health misinformation and disinformation.
You would see a lot of journalists, health journalists, yes, but more on the print as compared to broadcast. So even if you go for, let's say, an event or a story, you get like 10, let's say, print journalists, and then like 2 broadcast journalists. Because people were saying, what, health is scientific, health it's difficult. How do we get, let's say, information, the numbers, and then disseminate it in a way that it's very easy, for even the normal person to understand? Because according to our editor, you have to tell the story from the bottom up. With COVID-19, everybody all of a sudden is a health broadcast journalist. It's good that people are coming up and really being interested with health broadcast journalism, but then again, they end up misreporting. There's a lot of mis and disinformation, even as far as COVID-19 is concerned, even as far as malaria is concerned.
I think you had a lot of journalists, health journalists, cut their teeth during that time. And I think it was important in kind of giving health journalism sort of a crash course in some very tough science. When HIV kind of started hitting countries in Southern Africa really hard, we knew a basic science. We knew how you got HIV. We didn't have to figure out, okay, is this aerosolized? Is it not aerosolized? So we had kind of a base where you could do real, like, sort of standard kind of fact checking. So I think it was challenging for everybody in some respects. And that's just part of the infodemic. And I think that was experienced by journalists and policymakers. What the 24-hour news cycle does to news in a time like this, because everybody was on that beat. So I think there was a real high pressure on journalists to be the first to get things out.
First and foremost, for me as a fact checker, that's a big impact to say you're collaborating with the country's CDC to help fight the health-related misinformation and disinformation. During the Ebola virus outbreak here in Nigeria, more people died consuming salt water, ingesting salt water, than the actual Ebola itself.
There's also that aspect of then influence on the editor where, a call is made and your story dies just like that. Why? Because you question the data, you question the research, you wanted to find out the truth.
Sometimes not breaking the story is the best thing that you could do. Taking time and reading the study and questioning the data, the methodology.